Hey, what's up, everybody? This is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance based in New York. And we're back again with yet another episode of the Audiologist at Home episodes. Today, we've got Dr. Ariella Naim. What's up, Dr. Naim?
Hello again. Happy Monday.
Happy Monday. How you feeling there?
Doing great. Got a bit of nice weather over the weekend, so I'm feeling good.
We did. I actually got a little burned. I was outside trying to get a little vitamin D, and I did not realize how strong the sun was. So
yeah, gotta start wearing sunscreen now.
Yes, very important. So we are here today to talk a little hearing and balance. And as we've been doing with all these episodes, we've got some questions that are thrown at us, stuff that we hear kind of on a day-to-day basis in our practice when we're seeing patients. And today we have a question for you, which is a very important question because it actually impacts a lot of people that we see in our practice. And maybe even more people who don't even realize that they have what we're about to talk about. Okay. So the question is, what is presbycusis?
So that's a really good question. And that kind of makes up a lot of the patients that we see, like you said. Presbycusis, the easiest way to put it, is age-related hearing loss. And we know that about 30 to 35% of people 65 and older have some form of hearing loss. And then that number actually increases. So 40 to 50% of 75 years old and older have some form of hearing loss. And typically the patients that we see with presbycusis, when we do a hearing test with them, we see that the high frequencies are the ones that tend to go first rather than the low frequencies. Now, that's important to know because 95% of the information in speech and daily conversation is actually held in that high frequency range. So that's the consonants of speech, and that's actually the clarity of speech. So most importantly, when the clarity of speech is affected, whether we're in a quiet environment, if we're having difficulty, then it becomes even harder when we're in a background of noise. Now, some causes of presbycusis can just be genetics, the way we're wired to have our hearing. And there's no way to actually look at someone or look at a hearing test and say, okay, this is how you're going to lose your hearing, or it's going to progressively get worse. Other causes could be gradual changes to the inner ear that's due to aging. And that's actually the structures of the inner ear or the hair cells, which can be exacerbated by noise exposure, some circulatory causes, meaning medical conditions like diabetes, high blood pressure, can all have an effect on the inner ear structure. Now, sometimes, so all those causes that we just discussed, those would all cause what's called a sensory neural hearing loss. So that's coming from the auditory nerve itself. Sometimes presbycusis, though, can have a conductive component, which would be due to reduced movement of the eardrum, or even those tiny bones that we have in the middle ear space won't move as well as they used to.
Gotcha.
Now, some symptoms of presbycusis would be, again, lack of clarity in those the consonants. So it would be like the sh sound or the k sound. So it would be hard to distinguish between different words. Again, difficulty in background noise. Sometimes sounds can be a little too uncomfortable, so they would be annoying, especially loud sounds. And also, in some cases, we do have tinnitus that can occur at the same time as well. The reason for that being is that if we do have hearing loss, there's a lack of stimulation to the brain. And I know that we've discussed this in other videos, but there's a lack of stimulation to those brain and those frequencies, so the brain in turn makes up for that sound, which is what we're perceiving as tinnitus.
Gotcha. So what you're describing is kind of a blanket term for the aging of the system that occurs pretty much for all of us. There's no rhyme or reason necessarily. We believe genetics might have a component, as you said, things like noise exposure, other conditions, chronic conditions such as diabetes, high blood pressure contribute as well. it's really interesting because, again, we see so many patients with this, and it's hard to say to a patient, okay, the cause of your hearing loss is presbycusis, because it's an all-encompassing term. But we hear this quite a bit. Patients hear that word quite a bit. So definitely an important term to define. So I guess the real question is, once we determine someone has presbycusis, right?
Mm-hmm.
What can we do about it?
It's a really good question. So I think the first and most important step is actually start protecting your hearing as soon as possible. Whenever you are in noisy situations, wear earplugs, and they could just be generic earplugs that you buy at a pharmacy. If they're inserted properly, they can definitely protect your hearing. Of course, another option, which we discussed in another video, is custom-made earplugs. But definitely, first and most important step is protecting your hearing. Other things we don't necessarily have control over, again, like the way we're wired to have our hearing. But the next step would be is that once you've had a hearing test with your audiologist and you've determined that there is some hearing loss that can be treated, the way we can do that is through the use of appropriately fit hearing aids. Now, what we would do is we'd schedule what's called a hearing aid evaluation, and I'd love to talk about what an appointment like that actually entails in another video. But we would go through the different options of the hearing aids that are available. And another really important point is that most people ask, okay, so do I really need hearing aids right now with this hearing loss? The answer to that is the sooner that we intervene, meaning the sooner we start the discussion of hearing aids and start the process of getting the hearing aids, it's much better, and we see more success with our patients. Because again, we want to keep exercising that auditory nerve, keep the brain stimulated. So yeah, the sooner the better.
Good information there. So basically, presbycusis, there's really no medical treatment for it from a perspective of medications, surgeries, etc.
Right.
Dealing with that through an appropriately fit technology is the most appropriate choice, and clearly it's going to depend on the degree of hearing loss that you have and other needs and other components of your life. But most important thing is hearing tests first, also, to make sure that we know exactly what we're dealing with. So,
absolutely.
Great. So as always, the educational components of this from you and Dr. Zwiger are so important to help people understand exactly what they're experiencing and what types of questions they might ask regarding their hearing and balance related issues. So for anybody out there who has questions, you can always send them to us at info@newyorkhearingdoctors.com, info@newyorkhearingdoctors.com. We're going to try to get to these questions as much as possible. We're also really hoping that we're going to open up in the next few weeks. So
yes.
having these conversations this morning. So we're going to continue doing these videos for as long as we can, and providing as much valuable information as we can for anybody who's at home right now, and even after the fact. So with that, Dr. Naim, I appreciate your time today. Thanks for your insights.
My pleasure. See you soon.
Take care, guys.